Today, we are shining the spotlight on a business that is working in an area many of us don't pay enough attention to until there is a problem. Nobody will get a guess. But anyway, our dental health. For many Nigerians, a visit to the dentist only happens when there is pain, a damaged tooth, or an urgent problem. Hmm. But oral health goes beyond treating toothaches. It is about prevention, confidence, quality of life, and taking care of our health before a small problem becomes a major one. Today, we are getting to know about Abis Dental Clinic, the story behind the brand, what inspired its founders to go into dental care, the services they provide, and how they are working to make dental care more accessible. Joining us is Dr. Olayoju Bisola, founder of Abis Dental Clinic. Her vision is to educate people on oral health truths, make care affordable, and help everyone smile with confidence. You're welcome to Women Radio, Dr. Bisola. Okay. You can join the conversation by calling us on 07000 or send a WhatsApp message to 0703 1756 537. We are live on YouTube at WFM 917. Doctor, we have invited you to the program before, and I said Abis is very unique. Very, actually. And I asked you what it means. I remember you said accessible, better, inclusive, sincere. Hmm. We know that many Nigerians don't routinely visit the dentist unless something is wrong. I don't think I've ever gone to a dentist. Really, nothing is. I'm about to fall into the trap. Nothing is wrong after all. From your experience, why do you think dental care is still something many people overlook?
Okay, I would say ignorance
Hmm.
and people are not aware. So there is a lot of awareness you still need to create for people to understand the importance of taking care of their teeth.
Hmm.
Because with our mouth is the gateway to the body.
Hmm.
Whatever it is you're feeding yourself goes through the mouth.
Yes.
You can't take water to the nose. You take it to the
Okay.
mouth. You can't feed through the nose or the eyes. It goes through the mouth. So
Yes.
whatever it is you're taking to maintain your body goes through the mouth. So it's very
Hmm.
important to take care of your oral health.
Since we have an expert on oral health here with us, see, doctor, some things you say, okay, yeah, you're right. You know, when they say poto poto, that's saying on Lara, anybody it affects, pick your own. I know it will affect me because after all, I just said that nothing is wrong with me. I've never been to a dentist.
Yeah.
Just give us an overview on oral health. As a doctor, what would you advise a layman like me and maybe others listening to us on oral health?
Okay, first let me start with the reason. Okay, I've met with so many people, and just like you said you don't have any issues with your teeth. Yes,
Mm-hmm.
they only feel like it's when you have a pain or any severe pain, that's when you have to go to see the doctor. Generally speaking, even until you have headache or tummy upset or any, that's when you go to visit your physician, like a medical
Yeah, I don't
doctor,
go when I'm
right?
having a headache. It's when it is out of hand.
When it's out of hand, that's what, in
Yes.
fact, at first you go to do over-the-counter drugs to
Ah,
save yourself, but
we are
when it's
guilty.
getting out of hand, you go. So generally speaking, people do not really they're not so concerned about their health. They don't take their health
Mm,
seriously. There are some symptoms that won't come as a pain, but they
mm.
are telling you some things. Your body is, well, in fact, from your stomach, you might be having issues like ulcer and everything. It will tell you, can see it in your on your lips. I
Mm.
don't know if you've experienced any
Wait,
sore on your lips.
I would have sore on my lips
On your
because of
lips,
my oral health.
not just the oral health. Maybe there's a signal that
Okay.
something is wrong with your general health. So
Okay.
it's going to
Okay.
reflect on your mouth. It starts from the mouth.
Yes. Yes. It
So
is.
either way, there is a relationship between the oral health and general health.
Mm,
So we try to create awareness about taking care of your mouth, because when you take care of your mouth, you're taking care of the whole body. So now,
mm,
just say, for instance, pregnant women, there are changes in hormones when they're pregnant,
mm.
right? And
Yes.
some tend to have bleeding gums, swollen gums, right? Because of the hormones. So at this moment, we try to advise pregnant women to take care of their oral hair by visiting the dentist at the time they
Mhm.
take in, also to brush their teeth twice daily, floss, clean their tongue, and see your dentist regularly throughout the period of pregnancy,
Hmm.
because when there is gum disease of the gum in pregnant women, it increases the risk of low birth. Yeah,
Hmm.
low birth or preterm. Do
Oh,
you understand? Because of the
yes.
gum diseases. So, because when you have a disease in the mouth on the gum, your gum has a blood, is a soft
Mhm.
tissue. So it travels down to the veins, and
Hmm.
it circulates through the whole body. So it can affect the baby. So I'm actually encouraging and advising pregnant women to always see their dentist as long as they know that, okay, I'm pregnant. Please kindly
Hmm.
follow up with your dentist and take care of your oral health. It's very important. Then talking about to the first of all to children,
Mhm.
you know, baby teeth are quite softer and thinner.
Okay.
So as as soon as you see your child
Hmm.
grows two teeth, take him or her to the dentist. Take them to see the dentist. It is not as if they have any issue with their teeth,
Oh.
right? Or there is any pain or anything. No, it's just number one to alleviate fears.
Mhm.
When you introduce your child or your children to dentists earlier on, they get comfortable with doctors. Yeah,
Hmm.
nobody likes doctor because of the injections and the gloves. So when you get to introduce them, number one, they get familiar with the doctor.
Mhm.
That will help them to understand that, okay, my mom have been taking me to see the dentist, or my dad have been taking me to see the dentist right from time. So they will get used to it, because that's you instilling something educated in them.
Oh, yes.
So by the time they visit the dentist will be the one to check the status of the teeth. It will
Hmm.
also prevent bullies in future, because right now there are secondary school students or primary school students that are going through bullying, low self-esteem because of their teeth,
Hmm.
right? Because they've never for once visit the dentist, and
Mhm.
they have protruded teeth, like
Hmm.
maybe the upper tooth is longer than the lower tooth, or the lower tooth is longer than the upper tooth, so their teeth is not aligned. And in that case, they get to be bullied because you have a long teeth or your teeth is not aligned. They don't want to be your friend. You won't be able to smile confidently. As a child, they will just be there.
Hmm.
They don't have the confidence to even play or to be friend with anyone. So we are also creating awareness in schools. We get to go to schools, visit schools for free oral checkup to check
Hmm.
the status of their teeth.
Let me give Abis center 1 second.
Thank you. So we get to visit schools. When we examine them, we let the, we write we have a form we'll send back home, show the child to their parent that, okay, this child needs a proper alignment. They need to see the dentist. They need to see the orthodontics, because we
Hmm.
have a specialist that works on the teeth alignment. So
Yes.
that's what we do. And when you bring your child earlier to see the dentist, it will prevent cavities, because they take milk, yeah, and they take drinks, sugary stuffs, so they are prone to cavities. That's all on the teeth, yeah. So they are prone to it. And I've seen a lot of 5-year-old, 3-year-old, 4-year-old having cavities, like decayed teeth. And
Hmm.
constantly our parents, I think mothers, um they don't right, they don't put their mind when it comes to a child. Mommy, my
Hmm.
teeth is paining me. They don't get to,
Gargle with
attend to the child. They'll be like,
gargle with
okay,
salt.
I'll give you paracetamol. No, they won't even gargle with salt. They won't check. And even if they check, they won't know what is there. So how will you
Hmm.
know when it's not your job? You're not a professional. So
Hmm.
that's why they need to take parents need to do better by taking their, you know, child to see the dentist earlier on. Then you keep doing their routine checkup, not just for anything. You might take your child to see a dentist and not doing anything at the end of the day,
Hmm.
but at least the professional will tell you this is the status of your child's teeth, to prevent any future problems. Yeah.
Oh, you've
Then
spoken like a doctor.
thank you. I
That was
also
not a
talk about.
compliment.
Yeah,
That
what?
was not a
Oh,
compliment.
really?
Doctors will always scare you.
Do you know that this thing is, I know so many people feel like dental care is
Mm-hmm.
expensive and that. For you to prevent the expensive parts, that's why you need to visit your dentist early.
True.
You know, like you said you've never visited, you've not gone to a dental clinic before to clean your teeth. Yes, you're smiling, you feel like the outer part is okay. Have you checked the inward,
That's why I say you're speaking like a
the
doctor. You're
the lingual
scaring
part,
me
the
now.
inside, you won't see it because you can't even use your mirror to check. You
Yes.
can't say, and at the back of your tooth, the last tooth, lower and upper, do you take your tongue? If you put your tongue there, there are some things that I don't know how to explain it, but it's only the profession, it's only the dentist that will help you clean the last part, that the
Hmm.
last tooth. We are the only ones to make it clean. We will help you clean everything, and we work on your tooth one by one when cleaning it. So we take our time to clean it professionally. So it's not just about brushing or using hard toothbrush, because I know so many people use hard toothbrush when they have stains or calculus on their teeth. They'll be brushing as if they're brushing rug, and it's wrong. The proper toothbrush to use is a medium toothbrush, not too hard and not too soft.
At least I'm doing something
Stop
right.
using hard toothbrush. It will only wear away your gum.
Hmm.
Your gum will keep, receding. It will keep receding from the normal gum line, and before you know it, it causes sensitivity. When you take hot
Hmm.
water or you cold water, your teeth gets sensitive to anything hot or cold. So stop using hard toothbrush. Then I also talk about mouth odor, which I feel like is something that is general. At times, mouth odor doesn't come from just the mouth; it's systemic. It's systemic, which is quite best to see the dentist to at least find out what is actually going on. And most times, when you don't take enough water, you get to have mouth odor, especially let's say Muslims that that they fast, like early in the morning till evening. So I think I would advise them to use water. I mean, to gargle. Even if you don't want to take water at the time, you can gargle. And for Christians that fast too, they can drink water. I feel like they can just gargle with the water and drink. So to avoid mouth odor. Then
Hmm.
taking enough of water is very important, because you need the saliva to cleanse any particles. When you eat
Hmm.
rice, when you eat meat, even after gargling, there are still some things there. So when you have enough saliva in your mouth, it helps clean the remaining particles. And that's why we also advise brush morning and night. At night before going to bed, because everything you've taken from morning, afternoon, night, you would definitely have some particles, maybe from oil or anything, be meat you've eaten stuck in between the teeth. You definitely have some particles
Hmm.
in the mouth. So when you brush at night, it makes it feel fresh, because we have bacteria in our mouth, right? We have the good bacteria, but when you do not brush at night, the good bacteria get to feed on the food particles. When they feed on the food particles in your teeth, they get to release some harmful substances on the teeth, creating hole on the teeth. So it's very important to brush your teeth at night before going to bed. And brushing at night will also prevent mouth odor when you wake up in the morning. It prevents mouth odor when you wake up in the morning. Then take
Hmm.
water. Take enough water before going to bed. Yeah, so it's actually increases flow of saliva to help clean
Hmm.
the mouth and make the mouth stay um or what's it called, moist. Yeah. So that's just it.
Hmm. People like me, eh? Our listeners, if you're like me, you've gotten an airful this afternoon of all the things Dr. Olayon just said. The only thing I try to practice is brushing twice daily.
That's good.
Doctor, I didn't say I do it too.
Okay.
I try.
You try. Okay.
I
I
try.
know it's not easy on so many people. In fact, so many people take their bait at night, but just to pick up their brush and brush that is always difficult.
If
Why?
you're having taking your bath at night, even that one once in 24 hours now. But
I
anyway, that's not why we are
yeah.
here. There are dental clinics all over Lagos.
Yeah.
What would you say makes Abis Dental different?
Okay. There are dental clinics. I think our purpose is quite different.
Mm.
The purpose of Abis Dental Clinic is to um, create awareness and make people smile, help
Mhm.
people regain their confidence to smile. Because I know that I've seen a lot of people that when they have a broken tooth, especially their front teeth, they lose their
Yes.
confidence and they feel like, that's the end of it. It can't
Hmm.
be fixed. But when they get to meet or hear us that this thing can be fixed, or when they walk into the clinic, doctor, are you sure? because we've had several patients like that, that they've had
Mm-hmm.
broken teeth, that we help them to, fix it, and they were like, oh wow, wow, doctor, I'm so grateful. They've been battling with it, they've been struggling with it. Whenever they want to smile, they use white handkerchief to cover, or they use their hand to cover their mouth whenever they smile. So it's not been easy on them. So, but helping people to regain their confidence to smile wild, it's our purpose. And that alone gives us joy. That's the joy. So what we do differently is that whenever you come to the clinic, I know they said it's expensive, right? We make it easy for people. If you have HMO, you can use your HMO. Make use of it, please.
Mm-hmm.
It's very important. So many people pay monthly, but they don't get to make use of it because they don't even see the importance of cleaning their teeth or taking care of their, make use of it. And at the same
Mm.
time, we do payment plan for any advanced procedures when it comes to dental treatment. We do payment plan to make it easier. And for those that maybe on the low level that they don't even have the money, but they really need help, maybe extracting their teeth or something, we just find a way around it to help them. Yeah, we are not saying that we do it for free, but we'll look for a way to balance it. So just make sure that they feel okay, they feel better, they feel relieved. So that's
Mm.
what we do.
Doctor, remember my face and my name. So one day you will find a way around it for me.
That's all right. We got you.
Is there a particular service,
Mm.
approach, or experience that you feel Abis Dental is especially intentional about providing? I know you said you want everybody to like be able to smile
Yeah.
confidently. And during the last interview, you specifically told me that you try to make people comfortable
Yeah.
when they come
Yeah.
in. But apart from that, besides those two, what else do you do for your patients? Because when we go by what we watch in cartoons, doctor,
Mm-hmm.
we are afraid to come to the dentist. Dentists, they make them seem scary.
Why?
Pull out,
Is it the instrument?
yes, the instrument and the fact that they're pulling out your tooth.
Oh, okay. Yeah, pulling out of tooth is not, it's not as if it's not painful at all, but we give early like the injection that to numb the
Mm-hmm.
part we are taking the tooth out. So you won't feel much pain, but you'll feel the part where the pulling, you'll feel the energy,
Mm.
and after extracting your teeth, there are some drugs we prescribe, pain relief drugs and antibiotics to prevent further infections on that particular spot teeth is being removed. So what we do is that, let's say, as for instance, you've never done teeth cleaning or extraction or anything. So when you walk into Abis Dental Clinic, what we do is make you feel comfortable at the reception. Then when you're being called in, even from the reception, the receptionist would have been engaging you with some things, just for you to be
Mm.
comfortable, and you would have seen so many things, probably on the screen of
Okay.
how some procedures are being done. So
Mm.
okay, you are seeing it already. Okay, this is what I'm about to do, either the one you're going to do or not. By the time you get to see the dentist, the surgery room,
Mm-hmm.
we sit you on the dental chair and explain how it's going to feel, how you are going to be feeling, and
Mm.
that's exactly how you're going to be feeling. Let's say the teeth cleaning, scaling and polishing. We call it scaling and polishing.
Okay.
We will show you the instruments we'll be using, the tip we'll be using, the sound you'll be getting from it, and whatever it is will be coming out from the scaler machine. We
Mm.
have it's a tip. And with the machine, so once we start cleaning the patient's teeth, you feel the vibration. The tip will be vibrating on the tooth,
Mm.
right? And the machines there is water coming out of the scaler machine. So once the water drop in your mouth, and you feel like, okay, you can't take it enough, there's spittle boat to spit out. So we just explain everything, the vibration, and maybe the water from the scaler. So that's all about scaling and polishing. The vibration helps to remove the stains and whatever
Mm.
calculus on the surface of the tooth. Why the polishing is after the scaling, we have a brush to polish it. So with the paste, we polish everything to smoothen the surface of the teeth. So we explain everything so you can feel it. We'll give it to you, feel it. This is it, this is that, and that's it. Even if we are giving injection, let's
Mm.
say we are doing extraction, we'll tell you this is how you're going to feel. This thing, after giving you for another 5 seconds or 10 seconds, 20 seconds, you won't be feeling your that part of the tooth, because you feel like, okay, it's
Mm.
heavy, because is is in effect at the
Yes.
moment why you've been injected. Do you understand? So
Oh
we try to
yes.
explain everything. So I think that
Mm.
makes you feel comfortable. But when you don't explain the process on how you're going to feel, so you'll be like, okay, the anxiety will be there, and you won't feel relaxed. Uh, pro, um, why we proceed with the procedure? Do you understand?
Mm.
So, but when
Yes.
we explain to you how you're going to feel about it, I think you'll feel calm. Yeah, most patients, they're always happy. Okay, they know this is what I'm about to get into, so they already
Okay.
understand and they feel comfortable. Yeah.
Hmm. All right. Everybody likes goodies. And when you were speaking, you mentioned a promo that you go to schools.
Mm.
So, what special packages or offers do you currently have that listeners can take advantage of? And does it extend to SMEs or smaller organizations also to partner with Abis Dental?
Okay, yes. Currently, the package we have, yes, since we are celebrating our 40th anniversary this month, yes, it on thank you. On 26th of this month will be 4 years.
Hmm.
Yes. So but we'll be doing running our promo for 28th and 29th,
Okay.
48 hours promo. Yeah. So for children, what you're supposed to pay for like 25,000 naira for cleaning, teeth cleaning, you are going to be paying 10,000 naira. And
Hmm.
for adults, what you should be paying like 50,000 naira for cleaning, you'll be paying 25,000 naira for adults to clean, to get their teeth clean.
What how do I put it?
Mm.
Is a 20-year-old child an adult?
Yes, please.
Azana.
20, you know that number 20 speaks for itself. Yeah. So
Okay.
that's the package we have right now. And it's for everybody.
Hmm.
It's for everybody. Except those who are using their HMO, of course. It covers. So
My teeth must not pay me.
it's not you don't have to wait.
25,000.
You don't have to wait till there is pain, please. Just check. You don't even know what's in your mouth.
Actually, I don't.
You don't know. So you need to check. Okay, is my oral health okay? Most time we do free consultation.
Mm-hmm.
And I feel like people should just seize the opportunity to just check in. Let's see what's going on. There are sometimes that you have old developing on your teeth, and
Mm-hmm.
it won't give you any sign, no pain, nothing, until it get to a place whereby it's irreparable, that you have to
Okay.
pay more. So you don't have
Hmm.
to wait till then, please. Yeah.
Okay. That was my next question, but I put my foot into it and you've answered me already.
Yeah.
What is one simple dental habit you wish every Nigerian would start practicing today?
Brushing morning, and in fact that night is very important.
Mm.
Yeah, very important. Brush at night, because these bacteria get to act on your teeth when you're asleep, when the body is at rest.
Mm.
So when they don't have any sugary thing to work on, to snack on, so they will just be there, and drink
Mm.
enough water, you know,
Okay.
so that there will be easy flow of saliva in your mouth. When there is
Mm.
easy flow of saliva in your mouth, it keeps roaming around, nothing
Mm.
sticky. Yeah, and flossing is very important. I know they don't take it serious. Flossing is very important. Stop using toothpick. Mostly the gum diseases also come from use of toothpick. Reason is that toothpick is a stick, right? Like,
Mm-hmm.
so when you poke it on your gum, you're creating hole on your gum.
Mm.
I know people keep twisting and twisting the toothpick in between their teeth. Hey, you're doing more harm than good. So
Mm.
using toothpick creates hole. Why creating that hole gradually, you have food particles, tiny, tiny food particles storing up in the gum, inside the
Mm.
gum. That will lead to gum disease, infection, and all. That's why you see abscess, spots coming out of the teeth, swollen cheek. They don't know what's wrong. It's not as if there is issue on that particular, but in between the tooth, which is the gum, that's where the problem is coming from, by the use of toothpick. Stop using toothpick. Get a dental floss. It has a thread. Just put it in between the teeth. Take it up and down, then pull it out to clean your. Even if you don't have what's it called, my fish or meat stock in between, just clean it, because
Mm.
whether you brush now or not, after brushing you see there's this white film on the
Yes.
surface of the teeth, even after brushing and everything.
Mm-hmm.
So that is plaque building up. So when you gargle with water and you floss in between the teeth, so it won't have anywhere to stay. So please
Mm.
brush your teeth morning and night, floss daily, and stop using toothpick. Stop using hard toothbrush. Get a medium toothbrush, not too hard and not too soft. And get a soft brush for children. And remember to bring your children to see the dentist. Yeah.
Finally, before we go,
Yeah.
what has been the biggest challenge of building a dental business in Nigeria, and what have you learned from it? I'm asking because we see the glamorous part,
Mm.
we see the beautiful part, we see the success,
Yeah.
but the stories, the challenges,
Mm.
nobody sees it.
Yeah.
And maybe when you answer, it would inspire upcoming dentists.
Yeah. I'm very sure. I know we are still upcoming in this game
Mm-hmm.
because generally when it comes to dental business, they said until after 5 years
Okay.
before you can have your foot like in dental business,
Hmm.
you keep struggling. And that was what they said, that you keep struggling and struggling. In fact, when I started, I was like, no, I'm not going to struggle. My own is not going to be like that because
Hmm.
I have another approach to it and all. But then it's actually true. When it comes to human management, I feel like this thing is general.
Okay.
Managing people, managing staff, it's not easy. Today you
Hmm.
get a good staff, before you know it, someone poach them, or they just want to go to another clinic to work, or just because they will just leave. That's one of
Okay.
the challenges, getting to hire a good doctor.
Hmm.
Nurses are very easy to get, but getting to hire a good doctor around to assist in the clinic is one of the challenges we've had so far. Yes.
Okay.
Yeah. Yeah.
Hmm.
That's just, yeah.
Okay. So, doctor,
Hmm.
we would have listeners who would want to reach you, seeing as you are giving us promo. Everybody loves promo.
Yeah.
So, how can we reach Abis Dental? Your address, your phone numbers, your email. Are you on Instagram? Are you on Facebook? Please let us know.
Yes. They can reach us on WhatsApp via
Okay.
this number 070-8679-8998.
Mm-hmm.
Should I call it again?
Yes, please.
070-8679-8998
Okay.
on WhatsApp. And the normal calling line 081-3897-3493. I repeat,
Hmm.
081-3897-3493. And we're on Instagram, TikTok with Abis Dental. When you type Abis Dental on Instagram, yeah, you'll find our page there. On
All
LinkedIn,
right.
we are Abis Dental. Yeah. Then our
Hmm.
website is abisdental.com if you would
Okay.
like to book an appointment on anything. Yeah.
All right.
So the address,
Okay.
we are at 37 Channels TV Road, Opik, Isheri Estate.
Hmm.
Yeah.
Okay. Thank you so much, Dr. Olayanju, for joining us and helping us understand not just what Abis Dental does, but why regular dental care matters. Dr. Olayanju has told us now. Try to brush twice daily. I'm your host. Don't worry, I'll try. Let's start this challenge together. Maybe then the next time we see the doctor, we can tell her, okay, doctor, we listened to you and we have done what you said we should do. Anyway, from we at Women Radio this afternoon, have a lovely afternoon. Doctor, thank you for coming on Her Business.
Thank you so much. Thanks for having me.